Can I start by passing on my thoughts to the people of New South Wales, which has today recorded 1,431 new infections and tragically 12 deaths. This is devastating. On behalf of all West Australians, please know that we are thinking of you. We all send our best wishes to everyone caught in the crisis in New South Wales. But best wishes alone aren't enough. That is why Western Australia will continue to help with contact tracing. We have offered 250,000 N95 masks to those in need in New South Wales, and we will of course continue to offer any support that we can, including medical support. Australians help out other Australians, and that is what West Australia will continue to do. Our thoughts are also with the people of Victoria, where 208 new infections have been recorded. Yesterday, we announced our controlled border arrangements with Victoria will be changing to keep WA safe. From midnight Sunday, Victoria will be reclassified as high risk. This means people approved to travel into Western Australia from Victoria will have to have proof of a negative COVID test in the 72 hours prior to departure, proof of receipt of at least one vaccination dose, use the new G2G Now app, and undergo COVID tests on days 2 and 12. These border changes are based on our updated health advice. The aim is to keep Western Australians safe from the growing Delta crisis on our East Coast, so we can get as many people vaccinated as quickly as we possibly can. The message to West Australians in Victoria who wanted to return home is to do it now. Here in Western Australia, there have been no new cases. This is good news. It means our total number of active cases is now down to 10. 2 active cases remain in hotel quarantine. 8 people are on the Ken Hu bulk carrier, which is on track to leave Fremantle next week, and we're hoping that will occur. This is very good news, but the threat is ever present. Delta is deadly, and as we see across the nation, outbreaks can spread extremely quickly. In relation to the 2 infected truck drivers who arrived in Western Australia last week from New South Wales, all 25 contacts of the New South Wales truckies have tested negative on their day 5 test. This is a welcome development, but the risk from trucks entering from higher risk states right now is just too great. It's a risk we need to minimise as much as possible. That is why we are tightening our testing rules for truck drivers at our borders. From next week, all truckies from high or extreme risk jurisdictions who want to enter Western Australia will have to have returned a negative PCR test undertaken within the prior 3 days. Truck drivers who have not had a test will not be allowed to enter. Drivers who have had a test but do not have the results will be required to undergo a rapid antigen test on the border, both at Eucla and at Kununurra. They will only be allowed to enter WA if that test returns a negative result. Work is underway to upgrade directions to implement these changes to begin next week. 10,000 rapid antigen tests are on their way to border checkpoints in both Eucla and Kununurra as we speak. Today's announcement is about safety, about tightening our border controls to do everything we can to try to keep the virus out of WA whilst we vaccinate as many people as possible as quickly as we possibly can. It's about keeping Western Australia and its people safe and our economy strong, to protect our state from the growing crisis that is crippling parts of our nation. There is a way forward. It's vaccination. So get vaccinated. If you haven't, make a booking. New booking slots are being updated regularly. Our Midland Clinic will be open tomorrow for Indigenous people and families to walk in. It will open to the entire general public on Monday. The clinic will not only be a boost to people in our eastern suburbs, but it will complement existing clinics rolling out thousands of vaccines every day. We're picking up the pace when it comes to getting more COVID vaccines into people's arms. More than 1.8 million doses have been administered in Western Australia. This means more than 53% of the eligible population have had at least their first dose. and 33.5% are now fully vaccinated. I want to thank those who are working on this important rollout, and particularly people who are on the front line administering the vaccines. It's vital we maintain this strong momentum so more West Australians are protected through the pandemic. In closing, I want to reassure West Australians that we are doing everything possible to minimise the risk of COVID-19 re-entering the West Australian community. The measures in our border controls in place can be difficult and cause inconvenience for some people. I wish we didn't need them. But right now, given the situation over East, they are essential to ensure that we keep our community healthy and our economy strong. I won't be pressured by some from over East to bring down our border controls with COVID states against the health advice. Are there any questions?
Starting with truckies, why not rapid antigen test every truck driver coming across the border?
Well, you've got to, so the medical advice is that we need to do it with the states that are COVID positive. So the states that are COVID positive are New South Wales and Victoria. So if a truck driver has come out of either of those states, if they can't produce a negative test result that has been conducted within the prior 3 days, they'll get rapid antigen tested. And I think that's fair and reasonable. We're the first state to have done this. This is something no one else has done before. And it's trying to protect ourselves against drivers coming in who might be positive, particularly out of Sydney. I advised National Cabinet today that we're going to be implementing this next week as soon as we can get the tests out to the border checkpoints. It's pretty extraordinary stuff to do this, but we're determined to do everything we can to prevent the virus coming into Western Australia from all sources.
These new measures, is there any suggestion that it might slow down supplies getting into the state like groceries?
I wouldn't have thought so. The tests can be conducted very quickly. So the tests themselves can be conducted within a few minutes.
The 500,000 extra Pfizer jabs that are coming in September, will they result in any changes to the vaccine rollout? Will they enable high school vaccination clinics, for instance?
The vaccine commander will work on that. So that's Commissioner Chris Dawson. What else we can do? What innovative techniques we can run? Ways we can get it out to the less vaccinated parts of the population. So as you know, for instance, the Midland Clinic we're opening, the first day will be dedicated to Aboriginal people because there's such low levels of vaccination comparatively amongst Aboriginal people. So we're looking for innovative techniques. He'll announce further measures we'll take in coming weeks to get it out. At the moment, we're exhausting our supplies rapidly. Our vaccination rates now are very high, and so we're going up by about 0.7% each day in terms of our first dose vaccination, which means that we're churning through our supplies. So as more supplies come on, we'll get more vaccines into arms, but over time what it'll mean is we need to look at innovative ways to get it out there to low vaccinated parts of the population, and that's what the vaccine commander will do.
Given the changes to truckies, what about train drivers, freight trains?
Similar arrangements will be put in place with train drivers. Obviously, you can't put a testing regime on the border, so that's why it's a little bit different, but we have thought of that. And so we're going to put something similar in place, but it may well be that it's in Perth because we don't actually have a checkpoint for trains out on the West Australian border.
Was updated modelling presented to National Cabinet today from the Doherty Institute, and did that do anything to shift your stance on maintaining borders at 70 and 80% vaccination?
No, the meeting today confirmed my view that we have to have a precautionary approach on borders. And some of the modelling presented by Doherty actually indicated that borders work. So I'm very confident we're doing the right thing. I mean, you know, the idea that somehow we deliberately bring down the border at 70%, infect our citizens in large numbers, and then have to lock down our community and 5 people a day die is somehow a good idea is wrong. It's just wrong. So what the Doherty modelling does is it looks at various scenarios. And one of the scenarios it looks at where you have what's called baseline measures, which is basically 2 square metre rule, 1.5 metre distancing, lower capacity at stadiums, those sorts of things, which we currently don't have. But if you put those things in, and then you have a high seeding event at 70% 2-dose vaccination, and a high seeding event is basically if we open the borders to New South Wales and Victoria, you then have around 900 people die in the next 180 days.
And that
Hold on, let me finish. I don't want to do that. I don't want to do that. I mean, the idea that all these people over East are saying is we should do that, it's completely nuts. It's completely nuts. So I don't understand why they keep saying it. As I told them today, our economy is the strongest in the nation. We are producing 60% of the nation's exports. You know, the economies in New South Wales is closed. Where would they be without us? New South Wales is closed. So, you know, so we'll keep on our current trajectory. Now, all of that will change if we get outbreaks. If we get outbreaks, we'll have to look at what we have to do to defeat it as best we can. But at this point in time, we'll do our best to keep the virus out, ensure that we don't have community spread of the virus within Western Australia, keep the borders in place until such time as we're confident we can set a date by which we drop the border and give everyone the opportunity to get vaccinated if they aren't.
the PMO's office claimed that modelling was out of date to 5 or 6 tests per day. Are you saying that's not the case and that was confirmed today?
Well, I'll let them answer what they have to say, but the same modelling was tabled today.
Do you agree with the AMA then that 90% is a sort of safer threshold for Western Australia's vaccine target?
What I've said is above 80% we'll look at what we do, and then what I think the right approach is if we are still COVID-free, if we get above 80% two-dose vaccination, then we'll set a date. And it might be 6 weeks or so. And we say to people on that date, borders will come down with other states that are infected across Australia. Please go and get vaccinated. That provides a huge incentive for people to get out there and get vaccinated who aren't vaccinated at that point in time. And I think that's the right approach. As to, you know, like 90%, that's very high. I'm not sure anywhere's achieved that at this point in time. But when we get it over 80%, by setting that deadline, I think we'll encourage people, if there's vaccinations or vaccines available, to go and get themselves vaccinated, and that would be a huge incentive.
Was there any discussion today about how hospitals would cope with an outbreak? Do you have to be modelling around that?
There's ongoing discussion. Each state provides their details about ICU capacity, about ventilator capacity, about bed capacity, all that sort of thing. And I think the South Australian Premier said it, both South Australia, Western Australia, Tasmania, all going through unprecedented demands on our emergency departments. So lots of states are going through that. Obviously, if COVID came in, we have measures we'd put in place to expand capacity and free up beds, exactly as we did in the first half of last year.
New South Wales could reopen to the world well before WA. Is it a case that WA has to rethink its stance?
No. If anyone wants to go in the direction of New South Wales, they got rocks in their head. So we don't want to go in the direction of New South Wales. New South Wales had, 12 deaths today, 1,400 plus cases. It'll be the same each and every day now for weeks and weeks. So I don't want to head in that direction. I mean, I don't understand this national debate. I don't understand why everyone's yelling at the West Australian government. We're keeping the national economy alive. We've kept COVID out. We want to keep COVID out, and we'll reopen to the other states when it's safe to do so. That's a fair position. That's fair and reasonable. And I tell you what, if the situation was reversed, and if Western Australia was the infected states and they weren't, they'd be arguing that they should have a border to keep it out from Western Australia. They would. So, you know, look, in terms of New South Wales, obviously New South Wales got 1 million extra vaccine doses of Pfizer above their per capita share, so naturally they're going to vaccinate more quickly. Obviously that opens up opportunities for them that we don't have because we didn't get the extra vaccines from the Commonwealth Government. But eventually we'll open up to the other states of Australia, but we'll do it in a very safe, gradual, cautious way if we're still COVID-free at that point in time.
The Prime Minister was specifically asked if, you know, for example, New South Wales could open up at 80% internationally. Does that then fly in the face of the national plan? Because in the early days when it was agreed to, it was all states need to reach the targets together. So allowing one state to open up internationally, does that fly in the face of the national plan?
No, that wasn't the agreement. The agreement was if one state gets to 80% two-dose, then if there was a majority of states at that point in time at 80% two-dose, well then things would happen for that state in question. So it wasn't all states at once. Look, I mean, focusing on opening international borders in 3 or 4 months' time from now, it seems to me to be an irrelevant argument. What we should be focused on is fixing the problem that's occurring now. And so that's why we offer lots of support to New South Wales to help them to get through it. So, look, people are dying in New South Wales and Victoria. And if their hospitals fill, if the cases go out of control, well then people will die in large numbers. And that's what we should be focused on. And for non-COVID states, states that have kept it out or crushed it when it came in, our main focus is just keeping it out and getting our citizens vaccinated. That's where we need to be at this point in time.
Does the national plan still make sense when there are different states in such vastly different positions?
Well, it needs to reflect that. It needs to reflect that states are at different positions. When it was created back in July, the New South Wales outbreak wasn't like it is now. So therefore, it's changed. And I think the Prime Minister has said today or yesterday, I think his language is now, that different states are at different positions. A one-size-fits-all position is not working. The idea we bring down the borders and we infect our citizens when we get to 70% two-dose is madness. It's madness. And so I think the national plan needs to be amended to reflect that reality.
And the Victorian lockdown, that was hard and fast and hasn't worked. Are lockdowns tools that are just not as effective as they once were when it comes to Delta? And should that be taken into account when we're thinking about opening borders to other states?
Yes, it should be taken into account. If Delta gets in, it's hard to crush and kill. Now, we did it. It came in June and we crushed and killed it with the lockdown. Victoria did it in July. They crushed and killed it with the lockdown, but it came back again because it's got a big border with New South Wales. Queensland has crushed and killed it once. Northern Territory has crushed and killed it once, and South Australia has done it once. So I know I hear this argument all the time, it can't be defeated, but there's 5 jurisdictions in Australia that have done it once. But, if it comes back again, we may not be able to. That's the reality. I can't predict. But my aim is just to do my best to keep it out, keep our citizens healthy, bring down the interstate border with New South Wales and Victoria and the ACT when it's safe to do so. I wouldn't expect that would be before next year. Now, I know that'll result in people in New South Wales, commentators and the like, screaming and yelling we should bring it down as soon as we can and infect ourselves. I don't understand that logic, and I'm going to resist it.
Robbie, we've been speaking to a Sydney woman who's desperate to come home and see her dying mother. Her G2G pass was automatically rejected 4 times despite meeting all the criteria. It was only approved this afternoon after media coverage. What are other people in her situation expected to do if their applications are knocked back straight away?
Well, I don't know the exact details, but I do know police do review these things when it's brought to their attention, and they do a good job in difficult circumstances.
Sorry? Oh, it's not on COVID.
Oh, no worries. I was going to ask, I guess, just how realistic is it to expect the whole WA healthcare workforce to be fully vaccinated by the end of the year?
Well, we've been calling for people to get vaccinated since February. That's 11 months. I'd encourage people to get vaccinated. The healthcare workforce has been prioritised. And you think about it, the healthcare workforce administers medicines to people each and every day, 7 days a week, 365 days a year. Getting vaccinated should be a natural thing for them. And I'd encourage the healthcare workforce to do so. If they get vaccinated, they reduce the risk of transmission from themselves to patients who are sick, and they also reduce the risk they'll be absent through sickness from work. It's a very good thing for them to do, so that's why we put this in place. It obviously makes sense.
The 500,000 extra Pfizer doses, that will presumably bring forward our 80% vaccination rate, the time that it takes to get to that?
I don't know the answer to that, Josh. We'll certainly get it out as quickly as we can, but where this will go, where the vaccination rollout will go, is it will move towards trying to get it into the difficult to reach populations. So whether or not that's people living in small country towns, Aboriginal communities, multicultural communities, or less affluent parts of Western Australia, that's where the targets will have to be. And so as new supply comes on, we'll need to look to innovative ways of trying to get it out there into those communities, whether it's shopping centres or whether it's cultural centres or whether it's schools or whether it's innovative buses or the like that travel into regional communities and offer people the opportunity, or whether it's incentives. All those sorts of things will be part of it. Eventually, we'll get to a model as well to encourage people when we set the date, when we open the border with other states, that there'll be certain things you can do if you're vaccinated. If you're not vaccinated, you can't do them. So one that's speculated upon is going to the football. That makes total sense to me. So, a big crowd, you don't want someone who's COVID positive in there or unvaccinated in there. So there's, various things that will happen as we go down this road. But we certainly, the clinics are doing a good job. As I said, 0.7% of the eligible population is vaccinated every day. We climb by. And that's good, but eventually we'll have to look for those innovative measures, and that's what the vaccine commander, Chris Dawson, will do.
The Victorian government is going down that path and talking about drawing up detailed plans for what you will and won't be able to do at 80%. Would that form a blueprint for here in Western Australia as well?
Oh, well, we're working on that as we speak as well. But that's something all the states are doing. It's not, we've talked about that for a while. I know some people don't like that prospect, but, we're dealing with a pandemic that kills people. So we do things that, in ordinary circumstances, you wouldn't.
A lot of the other states have rough dates for when they think they're going to hit 70 and 80%. Do you have dates in mind?
I think they've been published. I think they're November sometime. So obviously, I think 70% to 80% is about 3 weeks. And then we'd look to go above 80% before we bring down borders with the other states, and then we'd probably set a date a couple of months after that to give everyone the opportunity to go and get vaccinated before such time as we brought the border down. I think that's entirely fair. And I advised the National Cabinet today, that's exactly our position. Now, obviously, if we have outbreaks like Victoria or the ACT or New South Wales, the plan would have to, by necessity, change. But at this point in time, that's our plan.
Just expanding on the idea of vaccine passports, you mentioned the footy. I think Dan Andrews mentioned going to the pub today. Things like that, going to the pub, going to restaurants, going to playgrounds maybe. Are those all in your thinking, or only large-scale events like football or concerts?
Well, it's also got to be things that you can enforce. So that's why there's a lot of work to be done on this, to work out what you can enforce, how you do it, what's appropriate, what isn't. But there's just another reason for people who are wavering about getting vaccinated to go and get vaccinated. One of the reasons as well that New South Wales and Victoria are getting vaccinated so heavily is they had extra vaccines given to them above what, per capita, above what Western Australia and South Australia and Tasmania have received. And also, because they have this huge outbreak, people will go and take AZ. So people will go and use AstraZeneca. AstraZeneca is a very good vaccine. It's worked tremendously well around the world. People here should go and use it. If the opportunity to get vaccinated is there, go and use it. And so that's why I encourage everyone to take that opportunity. Don't be hesitant. You never know what's around the corner. If we have an outbreak, you'll wish you'd got vaccinated. So please just go and preempt that and get vaccinated now. Use whatever vaccine is available.
Should COVID-free states be left to forge their own path, essentially, until at least 80% vaccination?
Well, as the Prime Minister said, I think he said it today or yesterday, different states start from different positions. And that's basically because of the massive outbreak in New South Wales. So now there's 5 states that are COVID-free. There's 2 states, 1 territory that are COVID positive. So we all start from different positions, and I think that should be reflected in the national plan.
The opposition has accused the government for failing to get skilled farm workers into WA in time for the harvest. Did the government fail to do that?
No, we've been working with the Commonwealth. We've been putting it to the Commonwealth. They should come up with ways using some of their quarantine facilities to get these people into Western Australia to assist with the harvest. And we've been working on the Commonwealth to do that for some considerable period of time. Look, I think it's a pretty cheap shot to attack us over this. We're trying to fight a major pandemic and keep the public of Western Australia safe. and we've been working on the Commonwealth to bring in people using their quarantine facilities as best we can. We've used one of our hotels, as you know, for low-risk seasonal workers out of Vanuatu and Tonga. So we've been providing hundreds of workers to the farming community for those purposes, but you know, it's pretty poor politics to attack us over that.
There's a suggestion that the state government has vowed to reach a quarantine deal with the Northern Territory for harvest workers. Is this something that was spoken about at National Cabinet?
No, it wasn't, but it's one of the things that we have been working on with the Commonwealth, but obviously international borders are their responsibility. I don't control international borders. The Commonwealth Government does. So that's why we've been working on the Commonwealth to come up with a very, very safe solution around this.
Some of these farmers are forecasting a $500 million loss to the economy. What would be your message to them if that's what they're suggesting?
Well, I'd suggest to them they go and talk to the Commonwealth Government who controls international borders. We don't. We've been advocating for a measure to do it in a very safe way. They need to go and talk to the Federal Agriculture Minister and Mr Barnaby Joyce to try and resolve the situation.
Was there any discussion at National Cabinet about the vaccination of children? The Queensland Premier yesterday raised concerns about that. Was there anything discussed?
Oh, yeah, sorry to interrupt.
So was there any position come to what came out of National Cabinet on that?
No, I think there needs to be more research and more analysis of it. We're all concerned about everyone across the community. So other countries around the world are doing trials and tests on vaccines for kids. We need to monitor and make sure that we put the right research into that issue. We all care about everyone, and making sure that that is dealt with properly is important.
Just back to the Sydney woman getting her G2G pass approved. If it's only the police commissioner and the chief health officer deciding which extreme cases gain entry, and these ones are getting knocked back straight away, how can they possibly be looking at them?
Well, you know, they are, and we've managed.
Getting knocked back straight away, so within seconds, so they can't possibly be in seconds.
Yeah, no. We provided. We're very sympathetic, but we also have to deal with a situation that confronts us in New South Wales, and we don't want to import the virus into Western Australia. So they deal with these matters as best they can in the circumstances they face. The Chief Health Officer and the Police Commissioner work 16-hour days, you know, every day to keep the state safe. So I think the issue is being resolved, but we're sympathetic, but we also have to balance that against, you know, the position the state is in and the position New South Wales is in.
Sorry, Premier, if they're looking at every individual case, how come people are getting emails back saying they've been declined within seconds? Are they waiting for them on a computer?
I don't know the truth, or otherwise what you're saying. I don't know the circumstances. I do know that the police do review these things, and they do the best they can in difficult circumstances.
If we got to an overall vaccination rate of say 85% being Indigenous communities and there's 40, would you open the border?
Yeah, they're the issues we have to grapple with. I don't want to see, you know, anyone die, in particular large parts of any community. So it might be Aboriginal communities, it might be multicultural communities, it might be poorer parts of the city. You might have 98% vaccination in the western suburbs, and you might have much lower levels of vaccination in parts of the wheat belt or parts of the goldfields or the Pilbara. They're the things we have to grapple with. So that's why we called for measures. You know, remember this national debate's gone on for 3 weeks. You know, all those sort of people screaming at us about, you know, why would you possibly want to have a lockdown? Well, having the capacity to lock down in restricted circumstances basically means you might have the capacity to stop people going into remote Aboriginal communities, to protect them. So, you know, they're the sorts of measures that might be in place even when you open up the borders to other states across Australia when we get to very, very high levels of vaccination. Thanks very much.